Welcome everyone to today's program. I'm Shannon Barnett with Becker's Healthcare. The program will begin with a presentation and we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have and will follow up on questions they do not have the opportunity to address. You will receive an email within about a week following the webinar that will include instructions for how you can download a copy of the presentation. You will also receive a follow-up email shortly at that time. This email will not include the presentation. It is now my pleasure to turn the floor over to Brian Warren from Select International to begin today's presentation.
Thank you, Shannon. We're thrilled as always to work with Becker's to present this webinar. The changes faced by each of your organizations are obviously driving the adoption of progressive and innovative talent strategies. And for most of us, the changes are overdue and necessary to support your organization's goals. But we often face the challenge of gaining buy-in from people outside of HR who don't understand talent beyond perhaps clinical or technical skills or where a nurse or a physician was trained. And another challenge is demonstrating the value of these strategies. How do they impact bottom line performance, both clinical and financial? Next slide, please, Shannon. We wanted to share with you today the story of McLeod Health because we think their journey along this path will be helpful to people. We also talk about some of the unique challenges presented by healthcare. While the basic concepts are the same, the strategies and implementation approach in healthcare cannot be taken directly from, say, manufacturing. For instance, we do a lot of work with Toyota, and so hospitals that use Lean or Toyota Production System seek out our assistance. And while our manufacturing work certainly informs our healthcare work, it's important to success to understand what's unique about healthcare organizations. So as Shannon said, please submit questions throughout and we'll incorporate them. But now I'm going to, if you can move forward on the slide, I'll introduce our speakers quickly. Tim Hess is Vice President of Human Resources and Training at McLeod Health in Florence, South Carolina. McLeod's been on the cutting edge in many ways, and Tim has been there for 20 years in a number of roles. And what's always impressed us about Tim and his entire team really is their dedication to constantly improving, to looking for ways to implement strategies that support the organization. In addition to being very smart and thoughtful about the way they do this, they have a passion that's really infectious, and some of it is because of the way they think about their culture, and Tim will tell us about that. Lori Wasco is the healthcare consulting lead at Select International. I'm lucky enough to work with her and her team. She's been involved in the development of comprehensive competency models and talent systems for community hospitals, large physician networks, one of the nation's largest dialysis centers and academic medical centers. She has a PhD in industrial organizational psychology, and before focusing on healthcare, she did extensive work in the defense industry and with leading companies like Sears, Goodyear, Verizon Wireless, and FedEx. So again, that work that she did in those industries informs her team's work in the healthcare space. Next slide. I was at the Becker's Hospital Review annual meeting in Chicago in May, and one of the keynote speakers was Michael Dowling, the CEO of North Shore LIJ Health. And one of the most interesting things he said, I thought, was there was a lot of talk about healthcare reform, about accountable care organizations, et cetera. But he made the point that none of that means anything if we don't think about talent and culture. And specifically, he made 2 points. The first was that we need to think differently about the leadership skills of the next generation of leaders because they're going to be significantly different than past generations. And we need to really focus on developing the skills for a team-based approach to problem solving in patient care, particularly patient-centered care. And we've got to move from the traditional siloed structures and thought processes we have, and we need to do that very deliberately. So we know that at the highest levels of the organization, there's this realization that things need to change. But what we want to talk about today is how do we gain buy-in and show the value. Next slide. What we'll do is we'll talk about Tim's journey at McLeod Health at a high level. Then we're going to bring it back to Lori and let her give some thoughts on some of the unique challenges in implementing these strategies in healthcare. And then we'll get back to the specific strategies and tools at McLeod Health and what we've learned, what's worked, what's been a challenge, and where we're going from there. So I'll hand it over to Tim.
All right. Thanks, Brian. And I appreciate our partnership with Select and your team. We've come a long way in our journey, and I appreciate the opportunity to be able to share some of that today. A little context about McLeod, just to set the table for our work, is McLeod Health is a not-for-profit healthcare system. We're based in Florence, South Carolina, and have 5 and soon-to-be 6 hospitals, a large physician practice division, and several other service lines that support the northeast part of South Carolina and the bordering counties in the southeast section of North Carolina. And if you look at it on the map, we're about an hour in from Myrtle Beach, or halfway between New York City and Miami. We were founded in 1906 and have a rich history with our mission to improve the health and well-being of those in our community by providing excellence in healthcare. We do this by focusing on our 4 core values: caring, person, quality, and integrity. And you'll hear about how those values are incorporated into our work as we proceed through this webinar. We've chosen to compete in the healthcare environment with a differentiation strategy focused on quality improvement and patient safety. And with the changing market, that's really evolved to include a strong focus on patient satisfaction. We've been nationally recognized for these efforts, originally beginning in 2000 when we received the Governor's Quality Award, which is the state of South Carolina equivalent to the Baldrige Award. In 2010, the American Hospital Association's McKesson Quest for Quality Prize. And most recently, we've received 23 top honors from Health Grades. In addition, our excellent patient care at McLeod has resulted in us in also being honored as a distinguished hospital for clinical excellence, meaning we've scored in the top 5% of more than 4,500 hospitals nationwide for our clinical performance, and the Outstanding Patient Experience Award we've received 5 years in a row. Next slide, please. So our journey, like most healthcare providers, we're facing many challenges, and the rate of change that we're addressing is really unprecedented in healthcare. ICD-10, automated patient records, doing more with less, and so on and so on. We've really created a lot of pressures on our staff and our physicians. In addition, the system continues to grow through mergers and acquisitions as we see a consolidation in services, especially with a lot of the smaller hospitals in our region. And also the acquisition of physician practices as they are migrating to health systems to help them manage their business. But we're also growing to an expansion of services as our population in the region grows, and the medical needs for specialized care also continues to evolve. While digesting these changes, our business model, as with other providers, is changing from kind of a quantity or fee-for-service focus to a value focus where quality is becoming increasingly critical. This fits directly in line with our strategy of differentiation, but is presenting new challenges to the way we manage our workforce. And lest I forget, we need to find more ways to do more with less, and we're focusing on our lean methodology, which is part of our operational effectiveness, and diligent fiscal management, so just keeping a close eye on our operating budgets. These pressures have required us in HR to really focus on being more in tune with supporting key operational objectives, more so than ever. And the question is, how do we continue to improve our quality and service initiatives and manage the complexities of change in a growing organization? And more importantly for my HR team is, how do we in HR not only adapt but really help drive these needs? And we've committed to our belief that it's really through the behaviors, the way we do our work, in addition to what we do, that will differentiate us as an organization in the future. Our patients expect quality as a given, but it's really how we treat our patients and each other that will lead to our success in the future. Next slide, please. Okay, and as an organization, this is just kind of a map where we've taken some of our organization driving strategies and tried to distill them into what we're working on in HR. And as an organization, we've set our strategic plan and operating goals on what we call our MAP, or our Management Action Plan. And that's focused around some learning we did years ago based on Harvard Business Review called People, Service, and Success, and defining success as quality. And then also we've added in stewardship. Developing our people has been focused in the past few years on training and tactics, really around supporting our service excellence program, looking at various tactics that we're doing to provide breakthrough service, and our measurement around increasing our patient satisfaction scores. Continuous improvement has continued our differentiation strategy to fuel growth through our quality programs that we call CE, Clinical Effectiveness, OE, Operational Effectiveness, and which is really where we focus on using lean methodology to eliminate waste from our system while increasing our capacity. And then stewardship is is achieved through deliberate fiscal management and working on efforts to use our resources wisely, but also work on patient flow through the system. And an example where this has really been successful on the operational side, that we look at our awards as just affirmation, but it's really the work at the bedside that is important, is in our operating rooms, where Dr. Michael Rose, who heads our OR service line, has worked very effectively with his team to improve patient satisfaction, flow, and quality. And they use, for patient satisfaction, have implemented a pre-op procedure where they focus on identifying that one thing that's most important to the patient to ensure they have a great experience. And it could be controlling pain, it could be concerns about keeping family informed, or even post-op nausea. As my wife was a patient 2 years ago, had knee surgery, and she had a bad experience with post-op nausea from a prior surgery. And while I was just in the prep phases with her before they sent me back to the waiting room, it was at least 5 different encounters where somebody talked to her about the extra steps they're going to take, and specifically what they're going to do to make sure her concerns about nausea are going to be managed and mitigated. They've also worked very hard on using our lean methodology to improve their flow and reduce wait times from even going through the pre-op registration experience all the way through the time they come in the morning to the time they go back to the OR, to try and help reduce those as much as possible. And then quality, Dr. Rose and his team have been noted for the timeout procedure that they use for all staff prior to the surgery, and that's based on some learning actually we've taken from the aviation industry. And John Nance, who's an aviator and consultant and writer, talks about the third chair, and the navigator sometimes is the one that sees the problem before the pilot or co-pilot do. Well, we've taken that to the OR, and everybody before surgery begins calls a timeout, and everybody has the obligation to speak up and to listen to anybody that may express any concerns about anything not being perfect for that surgery. Next slide, please. So with all this work going on, it's our strategic imperative to do business like we've never done before. And for HR, we've created this map on how we're going to make a difference and help drive these objectives. And our answer is we're going to focus in 4 areas: that we align our systems, making sure both technology and process are driving those things that are most important, especially when it comes to our people, that we hire smarter, which we'll dive deeper into later in this presentation. but how are we getting the right people on the bus and increasing the likelihood of success of those staff that we're inviting to join our team. And then leading better, focusing on performance management and accountability, that our leaders are coaching and holding people to those things that are most predictive of us being successful. And then that we grow success, that we ensure we equip and develop our people to meet the future demands of healthcare. So this kind of hopefully gives some context about what we're going to focus on a little later. But I'm going to turn it over to Lori to talk a little bit more in general about the context and talent strategies in healthcare.
Thanks, Tim. So, Lori, what I thought we'd talk about now is you've worked in a number of industries, but now you spend most of your time with hospitals and health systems. So what are some of the unique challenges that you deal with when you're trying to implement these sort of talent strategies and selection systems in healthcare?
So I always find it interesting, Brian, that based on my previous experience with manufacturing or with telecommunications companies, the strategies that we're going to implement are the same across different types of organizations. But with our work in healthcare, we really find that the organizational complexity of healthcare organizations makes that implementation piece a little bit more difficult. As consultants, we need to be a little bit more creative in our approaches, and this is really for a variety of reasons. First, healthcare organizations simply are complex organizations. There are a variety of pockets of stakeholders. Each of these different pockets of stakeholders have different needs. What they need to hear, what you need to provide to them in order to implement a successful selection process differs. So there's always a lot of buy-in, education, re-education, and we as consultants need to be flexible in that approach. Healthcare organizations, these next two bullets, they tend to be resistant to change, and also associates, there's a lot of professional autonomy in these types of organizations. So your employees care deeply about the organization and the culture of your organization. So when we talk about moving the needle and changing culture, people tend to be a little bit more resistant to that effort than in other types of organizations.
So that caring is great, but at the same time, implementing these strategies can be a bit of a challenge. And I think Tim, one of the reasons we have Tim on is that he's done a particularly good job, he and his team, gaining that level of buy-in.
Exactly. And then lastly, that idea of evolving measures of success. So in manufacturing, it's really easy to show success in these types of implementations. Productivity is that major piece of ROI. There are productivity measures that are consistent and standard across organizations. So it's easy to measure the number of widgets, the amount of scrap. In sales organizations, there's well-defined sales metrics. In telecommunications, well-defined call center metrics. But in healthcare, this idea of patient satisfaction, we know it's important, we know we need to measure it, but the idea of actually measuring it is still relatively new in the healthcare arena.
And tying the HR efforts to it is a bit of a challenge,
novel.
Because it's complex. Next slide, Shannon.
So here, this is essentially a hierarchy of what success might look like. So through the course of implementations, when we're measuring success, it's really important to remember there's no one-size-fits-all approach to measuring success. It's defined individually, based on the organization in multiple ways, depending on the organization, the stakeholders, and different contextual factors. So here we have a variety of outcomes that we like to measure in showing the impact of hiring and talent management processes. So the top of this funnel, turnover, time to fill, candidate experience, these are kind of the easy to measure pieces, if you will. These are the things that we're able to report out on a monthly, quarterly, yearly basis. As we progress down through this funnel, if you will, these metrics become a little bit harder to quantify, harder to measure, harder to tie back to the processes that we're implementing. So we have hiring efficiency, standardization, defensibility, patient satisfaction. We know they're important, but we need to engage in conversations about how exactly we can measure it and move the needle on these different areas, with the ultimate goal of patient safety, quality care, communicating and supporting the vision. So it's important to define what that vision is, what some subjective and objective metrics are that we can tie back, and then actually work with our stakeholders in order to tie back to those important defining factors.
And so when it comes to gaining buy-in, it's important probably to present all of this data to stakeholders and hiring managers so they see all the time. I know, for instance, because some of this can seem vague. I know Tim mentioned Dr. Rose, and one of the things that Dr. Rose talks about in his presentations is the first time they implemented an OR checklist, it didn't have the impact that they were looking for. When they went back, though, and attended to behaviors and culture, there was this level of buy-in, so the attention to behavior and culture had an impact that you could measure, and that's what we're trying to get at, right?
Exactly.
Okay. Next slide, Shannon.
So a lot of times we're approached by different organizations and they say, you know, Lori, Brian, we have a turnover problem. We want a test that's going to solve our turnover problem. And so Brian and I then need to kind of take a step back and engage in that discussion of, we don't want to implement a test for you. We want to implement a selection system, a process that's going to have an impact not only on turnover, but on a lot of other important organizational metrics. So it's really about taking a step back and developing a holistic approach and tying the process to the vision, mission, and values of the organization, so that we can then have a broader impact than just on, you know, turnover, for example.
Next slide.
One of the core approaches for doing that, first, we developed that organization-wide competency model. So it's important to develop that competency model, identify the standard language, and really tie back to that core mission values, what the important competencies are needed for success on, or for each of the levels in the organization.
And Lori, we don't want to gloss over that. We can't spend time on it now, but you really need to define it. So for instance, I was just in a room full of position leaders, and we said we were going to assess and interview and think about what leadership and collaboration would be. And they, of course, said, well, we all know what that is. We don't need to define it. But then when we asked each of them, we got 15 different definitions. So it's important, and I think Tim will spend some time talking about this, that you make the effort to define what these competencies actually are. Right?
Yep, define what the competencies are, and then develop, I would say, the competencies for each of the specific levels within the organization. So what, you know, teamwork and collaboration looks like at that executive level differs from what teamwork and collaboration looks like at the entry level, but it's important throughout the hierarchy of the entire organization. So here we have just some examples from that behavior selection and development approach that we would take. Select offers a variety of tools that we use for selection processes. The Select assessment for executives is used for executive assessment itself. It's an in-depth battery measuring the important competencies for success. The two, Select assessment for physicians and then Select assessment for leader development, these are in-depth assessments that we provide. They're used at the end of a hiring funnel and really provide a lot of good, robust, in-depth measurement you know, for each of the individual candidates going through the assessments. We also have fit assessments, which are top of the funnel assessments, kind of quick and dirty, 15 to 20 minute assessments that give you or allow you to screen out for high volume hiring funnels. In addition to the assessment piece, that is typically part of a selection process, we also offer select interviewing, so interviewing guides, online training around behavior-based interviewing techniques. And we find that this dual approach with the assessments and the interviews as well provides a really robust measurement across different facets of the selection process to make sure that we're hiring individuals who, you know, possess the minimum requisite on a variety of competencies.
And we don't want to spend a lot of time talking about our particular tools, but it's good to give a snapshot of the sorts of tools that build this system. And when Tim talks about what he's done, you'll see there are building blocks. There's building a competency model, there's adding the interview, there's adding the assessment, so that no particular piece of this is the solution, but when you start putting the pieces together, we start to have a system. Next slide. I think we'll just show you, we have a couple examples, right, Laura?
So this is an assessment called Nurse Fit. It's a top of the funnel screening device. It's a quick and dirty 15 to 20 minute assessment, and it's really great for high volume hiring situations. So it allows you to screen out about 10 to 15% of your candidate pool who don't possess the minimum requirements on a variety of competencies. It measures things that are imperative to different positions. So for example, here with Nurse Fit, we measure things like emotional intelligence, decision-making, patient focus, competencies that any nurse, you know, needs in your organization.
Next slide.
This is an example of one of our more robust assessments, the Select Assessment for Leader Development. This is about an 1.5 to 2 hour assessment. It measures 18 competencies across 4 major buckets: interpersonal style, leadership skills, thinking style, and then work style as well. So this is a really great way just to find get a deeper dive into your candidate, if you will, and identify his or her strengths or development areas across a variety of important competencies.
And we use this in healthcare not just for selection, but for development. We just worked on a few projects where we use Select Assessment for Leader Development for mid or senior level managers and leaders in the organization, and then look at the group aggregate scores. The other thing we did that was interesting, a client asked us recently to do a comparison between the Select Assessment for Leader Development results across our healthcare clients and compare them to other industries. And while generally they're consistent, because leadership is leadership, and we'll put this information out shortly, we found some interesting differences between healthcare and other industries when you look at leaders and some of the strengths and weaknesses. So we'll share that with the public shortly. Next slide.
Brian, can I jump in if you don't mind on that?
Yeah,
real
absolutely,
quick?
Tim.
It's just a little infomercial. I'm actually working on a key position for my team, and we use that tool on a finalist that we just thought we loved, and there's just something out there, and that tool really helped us find out and point in a direction that, as we dug just a little bit deeper, changed our decision. And you know, the finalist candidate who's actually starting next week, you know, had the same assessment and was clearly head and shoulders above, and we ended up getting a better candidate down the road, even though we had to go back to the drawing board because of this assessment. So it was very insightful and really helped us, I think, avoid a potential mishire.
Yeah, I think the great thing is it's not a silver bullet. It's not necessarily the determining factor, but as you said, if you have some concern, a tool like that can point you in the right direction. We use something very similar with physicians, and we found that if we identify during the interview or during the reference check some concerns, we can explore them with the assessment and say, well, this person really is weak in collaboration or patient focus, and that informs the decision-making process, no doubt. And with physicians, particularly, even if you're still going to hire that person, it's really useful to know what their strengths and weaknesses are coming in. Well, that's great. Perfect, Lori. Thank you. Let's go back to Tim now and talk about some of the specifics of what McLeod's doing, what works, and what they're going to do moving forward. Go ahead, Tim.
Okay. Thanks, Brian. And in preparing for this, I kind of stepped back to our really the beginnings of our journey as we realized that we've got to do things differently in HR to help drive our system where it needs to go. We started with an effort that we called Raising the Bar, and that was really just focused on trying to improve what we're doing to really enhance the collective intelligence around our hiring, selection, and promotion decisions. And, you know, with a focus on patient satisfaction and quality, we really wanted to make sure we're embracing our culture and getting those people that really fit who we were as an organization and really embraced our core values and aligned with that, so that, you know, it's just not hiring for technical expertise, but also, you know, the behavioral side, the judging not just what we do, but how we do it, how they carry out their work, how they interact with their coworkers and with our patients and customers. So we used an iceberg as our example, and the data we were collecting really only gave us the tip of the iceberg, and we wanted to look deeper and realize that there's lots of things we could do with improving our background assessments. Instead of just using the state-led support, we went with a more comprehensive nationwide background search. We looked at referencing and went, instead of just the phone and checking off the box that somebody said they're okay, that we went with an automated tool that we're getting incredible data with that. But those were things we could do HR with no worry about change and managing, you know, our managers' perceptions, all that. That was just something we did behind the scenes, and our recruiters loved those tools because it gave much more information. Where we really focused on efforts that needed some organizational change was trying to dig into the behavioral side of our selection process, and we used an old system and trained on behavioral interviewing, but really didn't go deep enough with a system we call Select the Best. But as we were looking for support, there wasn't the organizational readiness at the time, so we started real small and went with a different firm to just pull something off the shelf and did some generic competency assessments, and they gave a generic tool that worked well for our supervisors. Some liked it, some thought that they already knew that their interview process was the best and worked for them. So, you know, we didn't mandate anything across the board, but we wanted to make sure that as we're looking at things, we didn't sacrifice speed, the time to fill, some of those measures that we focused real hard on, because we realized that a vacancy at the bedside produces overtime and stress on staff. So we worked real hard on increasing the speed to get somebody competent to the bedside. But in looking at this new work, we didn't want to sacrifice speed for quality and efficiency. We wanted to do both. So we focused real hard on doing that. And to really get that going, we focused on pilot studies with early adopters, those managers and leaders that kind of got it and realized that, yeah, they have room to improve and we're open to trying something new. So, you know, we kind of used some, I guess, and the researchers would tell me that I was kind of stacking the deck, but by getting those early adopters, you know, that's going to hopefully show us positive results early on, and that's what we did, so that as we started using these tools, we compared those that were using them in our pilot studies with the rest of the organization to really look at what was working and focus on retention rates, turnovers, and even the managers' perceptions of the quality of their hires. And where we saw those bright spots is where we really focused to try and gain success and really set the table for us to dig deeper. And if you go to the next slide, please. With that success, what we realized we're trying to do is increase the likelihood of a successful hire. And I look at our candidate pool as kind of a bell curve. We have, you know, a critical mass of good, solid performers, people that will come in and do a good job. We have those that are going to be rising stars, that what we call role model employees, or future leaders. And then we've got the other tail of the curve that really we want to avoid. So how do we start hiring to the right side of that curve was our focus. And the continuous improvement actually shifted that curve to the right. And by hiring a higher quality or higher caliber person, we said we're going to be more successful as an organization. We're going to be more efficient. We're going to do those SE, OE, CE, and fiscal performance measures that we're going to need to be successful in the future, because those people will be naturally inclined to do those things. Next slide, please. So after some success and some trials, there's a growing demand from our leaders to really get more serious in our selection processes. And our HR team especially said, gosh, we know we can do better. And Brian mentioned our strive to continuously improve is we're always looking to be able to do things better. And we wanted to really find a way to amp up our behavioral competency selection process, and you know, through getting our managers better equipped, getting our recruiters better equipped, but continuing to get better data around selection. And I was involved with a HR affinity group around our lean initiatives, and listened in on a webinar just like this one today, where Brian and one of our partner systems was talking about what they were doing with behavioral competencies, and I was just intrigued by that. So as we dug deeper, I brought that back to my team, and we really thought there was a huge opportunity to support our core values and really dialing in on what makes McLeod highly successful. So the folks from Select came in and worked with us to develop a straw model of what we thought in HR was predictive of successful employees at McLeod, and not just successful, I should say, role model employees that really are the ones we hold on a pedestal. We said if we're describing this person and as they perform their role, whether it's a nurse or somebody on the front line or a leader, this is what it takes for them to do their job, and these are the things that differentiate them from others. So we took that work and you know, began to socialize that with our leadership, and a lot of informal one-on-one meetings where I or some of my team would be working with leaders and just sharing the work and getting their input. We do find that in healthcare everybody likes to be involved, so we brought them in early. Functional groups, nursing care leadership, and some other forums, we asked them for input. And then our formal HR ops, it's a biweekly meeting we have where we address HR issues with our campus administrators and several senior leaders. Really brought them into the fold to say, here's our straw model, react to it, spend some time with it, and then, you know, help tell us who your best people are. Who are your role models? And we asked for, and we ran reports to give them who got the highest performance scores and all those. And we said, give us the names of your role model employees. And we worked with Select to set up, I don't remember how many focus groups, but over a period of about a week and a half, close to 30 focus groups across all levels of the organization, where we brought the best of the best in to ask them what makes them and their peers highly successful in their job. And this process really helps kind of introduce the concepts across the organization, because we had our leaders talking about it, but we also had staff going back because we told them that they were purposefully chosen as being considered by their senior leader to be one of our star performers. So really was affirming for them, and people love to talk about cool stuff. So they went back and talked to their peers about it. So that helped us really get the gears turning to support our intentional focus around a whole body of work that we then labeled as hiring smarter. Next slide. And in doing that, we really took our behavioral competencies to the next level, and we created what we call our core value standards map, and went through about 7 itinerations of that as we worked on it, took it back for feedback, and came back and finally ended up with about a 90-plus page behavioral dictionary. And I'll show an example of that, but it really is talking about not just the competency and a description of that, but it got into what behaviors, what do we see, what our managers or our recruiters see that contributes to success, and then what are those behaviors that take away from that success. And that really became the foundation of our work around hiring, but also it's informing our performance management system that we're rolling, or just in the process of rolling out this year, we call Insight, as well as our development work in the future. Is if those are what makes our employees successful, then our training and development work, our growing success efforts, should be designed around building the skills and our employee competencies to perform their jobs better. So a lot of the tools that were mentioned by Lori, we created per job family interview guides, the learning, and based on our culture, and we got a nice report from the researchers that did the focus groups. We really actually took the assessment and fine-tuned it and recalibrated it to fit McLeod, because compassion and I think the other one was emotional intelligence really carried strongly. So the assessment tool that we use was tweaked. The algorithms were tweaked really to weight those and give those more credence, because that's what we determined for our organization was most predictive of success. We also looked at our systems and aligned them to make sure we leaned out the behavioral assessment and didn't make it cumbersome, because we didn't want to lose candidates or slow down our time to fill. So our workflow in integration with our applicant tracking system automatically serves up the assessment as part of the application process. And we look at each part of that process as a step or a test. And to do that, we want to make sure it was easy, though, and that we didn't lose any ground by doing that extra step. We also looked at implementing that bottom 15%. We got pretty aggressive after we got comfortable with using the assessment and implemented cut scores. That's where, if somebody scores in the bottom 15% of the assessment, then that's a knockout, and we don't, consider those candidates to move forward in the process. And then some of the training. There's a great online training program that really has taken our behavioral interviewing training to the next level that we put our managers and leaders through. It also, we do an online, or not an online, but an on-site components with our training and recruiting team, and we've certified 6 trainers to do our Hire Smarter training, which is an accompaniment to the online training that they get, to really make sure that they understand the whole process, and that we use the BAR methodology to make sure that we're getting a full picture on the questions, not just getting the answer we want to hear. And then, you know, all that work has really led the foundation for our hiring smarter and leading better. Next slide. And then this is just a picture of our competency map, where we've got 7 job families that we assess for and have grouped together. But as you can see on the left side, our core values, each of these competencies drive our values: caring, person, quality, and integrity. So our beliefs and then those competencies are what we believe drive success. And then what we achieve, hopefully, is to be the choice for medical excellence. And we do believe that we want to be the, not a choice. And choice is powerful because, you know, with consumerism in healthcare, our patients are realizing that they have a choice. So we want them to see us as the obvious choice, and we look to increase patient share and patient satisfaction as much as possible. Next slide. And then we talked about those contributing and detracting behaviors, and we worked real hard to McLeodize or fine-tune our Competency Dictionary. So not just the general description, and I've got communication and listening for one of our levels or job families up here, but really to get in and describe in detail what those contributing behaviors and detracting behaviors are, because that supports our goal of clarity in communicating our expectations and standards. And this work then became the foundation for the custom writing assistant we built in our performance management system. Next slide. And a lot of the work currently going on is based on some current reading we had our leadership team go through that focuses on some work from Patrick Lencioni. And the book we read as a leadership team was The Advantage, and it talks about really organizational health and achieving organizational health through 4 key focus areas: creating a cohesive leadership team, creating clarity, reinforcing clarity, and then over-communicating clarity. And in HR, we see our big opportunity to contribute is in the reinforcing clarity, and that's making sure your systems are aligned to support what's important to the organization. So our Hire Smarter and Lead Better efforts have actually become part of our management action plan, which is our goals system, and also our leadership incentive program is driven off of that. And one of the goals around people is that each leader will be responsible for attending and becoming competent in our selection systems as well as our performance management system. Next slide. And I mentioned kind of where we're going with this work in leading better is performance management is using those very same behavioral competencies. If we believe they're important enough to select and promote staff to, then we also need to hold people accountable for that. And in that system, we used an automated system, and the custom writing assistant really makes it easy for our leaders to give very specific feedback, and you know, whether it's affirmation or constructive, you know, feedback that they can do to help our staff develop, or if not, also help hold people accountable to our behavioral standards. Next slide. And then this work also is the foundation for our development, or what we're calling growing success, and we'll continue with our leadership to work on our employee relations and our PEP, which is our corrective action, positive expectation process, leading better, hiring smarter, as I mentioned. But also we're working on development of a curriculum to really help people improve their skills and their competence around those behavioral competencies. And then I just have two classes we're going to be offering on improving emotional intelligence and enhancing trust. Next slide. We'll be working on the same things with staff, more tactical with our service excellence strategies, empathy and managing up are two tactics we use, but also problem solving, communication, and collaboration, again, in their competency grid, are critical for successful performance. And believing that we can always improve, you know, we believe that each staff member has the capacity to continue to do better in their personal application. Okay. Next slide. So looking back at this work and just kind of flew through probably a culmination of several years worth of work, you know, some things that have worked for us is you know, gaining buy-in is critical, and you know, really embracing those early adopters has been a great tactic that we've used to get people that are already drinking the Kool-Aid, get them on board, and once they become internal champions, it's much easier for them to pull things from HR than it is for us to push things out. So as we're creating more and more of those victories, just things continue to get a little bit easier each time we want to even roll something out or expand something new. Also, I thought, you know, focusing on success was critical, and using our role model performers as a way to validate this work. Not only did that give them affirmation, but it really gave us some incredible information, because those are our stars, and to learn from them and what makes them tick and what they think is important and what they embrace really helped inform a lot of this work. And then socializing the work continuously with leadership and staff. You know, I think one of the things that I remind myself and our staff is not to underestimate the value of even those informal conversations, because the more we can have this work out in front of people and be asking for input and opinions. Everybody loves to share opinions, so you know, this is work we want them to use. So yeah, let them kind of embrace that. Just makes it easier as we want to roll forward. On the flip side, you know, where we've struggled is, and I think Brian mentioned some of this in setting the stage for healthcare, changing behaviors and dealing with some of the mental models has been tough. We have some really good managers who have some really bad interview practices, and trying to overcome those has been a great challenge. So, you know, trying to get rid of the questions about, well, if you wore 2 different colored socks, what would you do? Or we even had a manager who's tremendously gifted but has a happy scale question that she asks and thinks that is the most predictive of successful performance. And I know it makes our PhD folks from Select shudder on the validity and reliability of those type of questions, but trying to overcome some of those is something we're still chipping away at. And then getting some specific feedback, getting managers really to document for us so we can learn why they're not seeing somebody as a good fit. You know, we want to take that information back so our recruiters can learn and dial in the candidates that we're sending forward, because one of our goals is, instead of sending the whole cadre of applicants, is we want to take the cream of the crop and assess for that, and then just send those select few to our hiring managers. And then cut scores, I mentioned that's worked great for us, and we've really tried to look and validate where we've made exceptions or had, you know, pressure because somebody's connected to somebody, or we had a manager that went out and kind of implied an offer and they ran through the assessment. Those that scored low, we have watched through the organization, and most of them we see performance that was fairly well predicted in the assessments. And that kind of leads us to what's next, and where we're looking and having some dialogue now with Select is really to look at our assessment tools and do some validation of our competencies. We've been doing this for a couple years now. We've got a lot of good data, but we want to dig deeper and make sure that, you know, what we're measuring is really getting measured and that it's predictive of success as we had thought. So we're going to dig deeper into that. And then also looking to, you know, beyond turnover, even early turnover, is to look at ways that we can connect our selection decisions and who's following our processes to the operating performance of those units. So those that we think are doing a better job in really using the tools appropriately, we would expect that they're making better hiring decisions, and that should show in the patient satisfaction, the fiscal performance, and other operating measures that are important. So we're going to start trying to find ways to start connecting those dots in the future and hopefully gain insight, learn, but also continue the momentum to really evolve this work. And I know we're trying to allow some time for questions, so I've covered a lot fairly quickly. So Brian, can I turn back to you?
Tim, no, that was perfect, and we have a lot of questions. We'll be able to answer a few of them. Anything we didn't answer, we'll send out a note and get an answer to everybody. But I just wanted to make a comment. The thing that you hit on at the end was there was a lot of work required with this, and Lori and I were chatting offline here that in a manufacturing facility, once you decide you're going to do something like this, you do it. You educate people, and then you move forward. Because of the various constituencies and the professional autonomy and how much they care, you can see how much work went into gaining buy-in and going back, and there's a feedback loop when you're working, so that's really important. So I'll hit a couple of the questions, and we'll try and answer them relatively quickly. The one thing I think I might be able to answer for you, Tim, is that you had mentioned automated reference checking, and are you still using it, or has it been replaced by the behavioral assessment? I don't believe you've replaced it, but they're both part of the system now, correct?
Correct. It's a complement, and that's when I talked about wanting to improve our intelligence. Yeah, each one of these is I call it a test along the way, and we get incredible data from both, and we use a company called Skill Survey to do that, and it's still a vital part of our screening process.
Yeah, and we have a lot of clients that use Skill Survey, and we agree the systems complement each other very well. Tim, you had mentioned the CUT score. One of the questions came up with, does that create a potential legal problem? And I'll hand that off to Lori and give you our thoughts on that. Yeah. Because the CUT score has a great deal of utility, but some clients are concerned that it could potentially create a problem.
Right, and we recommend it, saying that it wouldn't cause a problem, not if it's used correctly. So particularly in those high volume situations, it's our recommended approach there. We're screening out, you know, that bottom 15% or so, and then everybody who scores at or above the CUT score and progresses on to that next stage of the selection process should be treated equally and fairly. So I think the consistent and standardized implementation, Brian, of that CUT score is imperative in order to use it correctly.
And basing all of it on job analysis work that establishes job relevance, because that's what the EEOC and the OFCCP are going to be looking for. And that actually goes to, I had two similar questions. One was, how do you actually measure culture, and how do you set up the assessments to reflect that? So how do you develop the grading on a particular assessment? And Lori, in our work, it's usually based on that competency work that we did up front, which Tim didn't get into. Maybe you could describe quickly how we gather that data.
So we gather it through a variety of techniques. I think Tim talked a lot about the focus groups with leaders and stakeholders in the organization, high performers, so gathering qualitative feedback about the competencies that are particularly important in different areas. And then also sometimes we supplement that with a quantitative survey that we'll send out to a larger sample of individuals in order to gather some quantitative data to support those competencies. And so we'll use that information in order to identify what those most salient, most important competencies are, and then use that information to impact the specific scoring profiles that are put in place.
Yep. And the next two questions are actually about physicians. So one was asking about the unique challenges for the new breed of physician leaders, particularly those who are MD, MBAs. And what I can tell you in our work is I don't know that it changes anything for that breed of physician, but what has changed are the expectations of physician leaders. And the MD, MBAs I've seen perhaps come out of those programs with more awareness of the importance of these behavioral competencies, of emotional intelligence, of team building efforts, of problem solving, of collaboration. There's an awareness of it because it's addressed in the program. but as a whole, there's still a dearth of discussion about that. So when we work on those projects with physicians and physician leaders, I can tell you they're really receptive because they have new expectations, but they've not necessarily been given a new skill set. And the other question, Tim, came from someone in the audience was, how supportive have the physicians been of your efforts?
Yeah, and I think the way we involve physicians is we use especially with our quality, that we're evidence-based, data-driven, and physician-led. So with this work, we've kind of carved out the physicians. Early on, I said that they were out of our scope because we have a separate group that is really working on physician development, and one of the things they're looking at is physician leadership and physician selection, because they're realizing the same things we're learning as an organization. So these are very intertwined in what we're working on, but we're letting the physicians really lead and drive that work, and it's not just our employed physicians, but it's also those that are, just interested in supporting the hospital that have privileges. We've got 2 different work teams that are doing that, and instead of us pushing something on them, we're letting them kind of learn and figure it out, and that work's moving slower because they're not dedicating as much time as we are, but they're moving this forward, and what they're coming up with is something that looks very similar to what we're doing on the staff side. I
think, Tim, you're fortunate in that your physician leadership gets this. They've always gotten it, and they're pushing it forward. The other question I had for you, Tim, was from the audience. Can you talk more about the performance management process? How do you assess each employee's competency for the behavioral standards, and what's the process for managing up or out?
Okay, well, and we're actually going through some dialogue right now on the managing out part, treating negativity, which is covered in several of our behavioral competencies. But it's really focusing, I think, on performance management is focusing on those contributing and detracting behaviors and being specific. We've taken great effort to make sure that we've defined that as thoroughly as possible, and we're training our leaders on giving feedback and managing staff and holding people accountable. And instead of just saying you have a bad attitude, we're pointing them to those competencies in the dictionary to say, all right, let's take that to the next level and really get specific. What are you seeing? We kind of use the video camera. What can you see or record audio that lets you know that person's having a bad attitude, and getting them down to that level of granularity so that they can hold people accountable. Now, we still have to do the Joint Commission competency validation and the technical skills, but the behavioral side is just as important, and really that's where the bulk of our effort's being focused. Did that get?
Tim, yeah, and that's perfect. And I think that goes to the whole idea that managers, supervisors need to have a role in talent, and that selecting the right people, developing the right people is a big part of what they do, and it's critical.
Yeah, and our goal is to have the tools and systems to support that, but it's really up, and our focus is on equipping our managers to be able to execute.
Right. Well, we are just about out of time. As I said, there are some other questions, and we'll send responses out to people directly. I wanted to make sure to thank Lori and Tim for their time. I love sharing Tim's story. We love working with them. As I said, there's a passion for what they do, and we appreciate it so much. And thanks, of course, to the folks from Becker's. And I'll hand things back to Shannon.
Yeah, wonderful. Thank you, Brian. I want to thank our presenters again for their excellent presentation, and for all of you for participating today. We look forward to having you join us for future webinars. This concludes today's program. Everyone, please have a wonderful afternoon.